the final stages of major depressive disorder is suicide. Back in 2018, the number of those affected by mental health challenges was 1 in 4. After talking with a healthcare provider in Lafayette, they say that number is now higher.
So we all know someone that's impacted, or we've been impacted ourselves, and that's why it's important to get the word out and to get people educated.
In 2023, the Tippecanoe County Coroner's Office investigated 30 suicides. This was a 36% increase compared to 2022, although numbers have been relatively high dating back to 2018. Brandy Christensen says the stigma around talking about mental health is due to shame and vulnerability.
There's so much mystery around it because we have, historically not talked about it very openly. There's a shame element that is involved in the illness of the brain.
While mental health affects every age group, Christensen says there's been a notable increase in how this is affecting the college-age demographic. Already in 2024, at least one Purdue student has died by suicide.
It's our demographic that we're concerned with right now, right? That's what we're seeing on the news. That's what we're hearing about in the coroner's report. So we have an impetus to connect with the college students.
Following student suicides in 2022 and 2023, Purdue released a statement at the end of 2023 with plans to put more funding into their mental health service known as CAPS. While the university makes this resource known, one student says it's not always the most approachable.
It's just hard because it's a big school, so it's hard to seek that out and get that intimate one-on-one help where you can be vulnerable and have an open space.
Franny Whalen and Emma Long are students at Purdue University. They are part of the American Foundation for Suicide Prevention at Purdue. This is one of several mental health related groups students are forming around campus.
Because there's a huge importance in community, so I think having these small communities really helps students be able to talk with others and show others that there is way out of the darkness.
Christensen says many barriers prevent people from seeking the help that they need. This can be from certain industries of work to even insurance policies.
They might be ready for help, start to try to get help, get some doors slammed in their face because this insurance is not accepted by this therapist.
Mental Health America provides resources to help eliminate these barriers. Tools are provided for those struggling with mental health challenges and those who might know someone who is.
There is nothing more beautiful than addressing your mental health and leveling up your self-awareness.
Christensen says breaking the stigma will require more work to be done at the state level in normalizing mental illness as any other illness. And as Mental Health America continues advocating, they are also working on bridging the gap to make resources accessible to not only those in Lafayette, but also students at Purdue University. Reporting in Lafayette, Ella Chu, News 18.